congratulations. Here in Las Vegas, this has been a good year, right?
Yeah, I mean, it's been an incredible year. You know, it's great to be back in person, and I think registration is through the roof. And I think the energy in all the sessions is really
You're feeling
outstanding.
it.
And you know, it's been years since we've had this many sessions that are totally full. And I think the people are engaged, and you know, the networking is at a high. So I'm very delighted for the team.
I guess for you on a personal level, what has been the biggest highlight, or have you had several highlights?
Yeah, it's hard to say one, but last night we had our meeting of our department alumni that was from Wisconsin. And, you know, it was totally full, and I had seen people I haven't seen in 20 years. We might have broken a fire code, you know, in that room, but it was great.
Well, it is Las Vegas.
Yeah, it is. What stays here, right? What happens here stays here. But it was a great evening, and that was just last night. But so far, that's the highlight. But it's all been great.
Have there been any big breakthrough in terms of science here this week?
Yeah, I think that there are probably a few that are quite notable. One thing is I'm an expert in kidney stones. And I think really for the first time in years, you know, we have sort of a new treatment for stones where you can actually suction and remove pieces of stone without making an incision, which we usually have had to do for the bigger ones. So you can suck it out. And I think we really are talking about the adoption of this and the importance of it. So this is very exciting in our field. I think in the area of cancer, we finally seen some quality of life data. So sort of patient-reported outcomes that are saying that maybe just, you know, taking the bladder out and then, you know, recreating, you know, a different way of life might have actually quality of life benefits as opposed to leaving the bladder in and getting all this treatment.
All right, what would you like, sir?
Regular coffee, black.
Yeah. All right.
Hey, thanks for the coffee, Staplers.
You are so welcome.
Great.
This year in particular, you said it was very successful. Why do you think, or how do you think AUA is making a difference today?
Yeah, I think at the highest level and as a trickle-down effect, you know, the organization is just adapting and they're listening. And we are trying to, you know, get things right for urologists, patients, you know, and everyone in healthcare. And I think that's an evolving approach, but I think we're doing well and we're heading in that direction. And I just see more of that on the horizon for us. And a lot of, you know, when I was a AUA member and when I first joined, I really didn't understand, you know, how much the AUA does. At all levels for all different people. And I think, you know, now, you know, we've been more open about what we do. And I think, you know, that's been a big plus.
Well, thank you so much, Dr. Nakada. I appreciate it. It's been so nice to meet you.
Well, it's been my pleasure, Stacy. Thank you.
Thanks for watching. But now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.